Welcome back, fellow mitochondriacs. Today, we are going to be discussing a very important topic. And although this topic seems like it would be more generalized for the population, talking about blood glucose, it is of incredible importance for those trying to treat cancer as a metabolic disease and to try to get your blood glucose parameters and your glucose ketone index and the parameters that make sense and are going to help you have the best shot for having the outcome that you're looking for. And I have been I've been dealing with this for quite some time now, you know in general practice, but also as an integrative functional medicine doctor, and then now with helping folks with getting their GKI in the right space and implementing metabolic therapy. I have found that this is probably the most difficult part of the therapy. Now, are there more expensive parts of the therapy? Yes, there are more expensive parts of the therapies. Good evening from the UK. There are more expensive parts of the therapies if you're looking into IV vitamin C, if you're looking into HBOT. Those therapies, or even Dawn, those therapies can be pretty expensive. But in terms of difficulty, straight up difficulty, getting your blood sugar below 80 on average and getting your GKI near 1 or less is probably the most difficult part of the therapy. And, just being very frank, not, most people who end up having, cancer don't have, the best metabolic health. And so therefore they're starting from a place of insulin resistance or diabetes, whether it be, type 2 and no insulin, or type 2 and insulin, which would be kind of the worst case scenario. Because if depending on how long you've had diabetes and been on insulin, you may have irreversible pancreatic beta cell dysfunction and you may not be able to ever get off insulin. Doesn't mean you can't get your blood sugar down, but it just means you probably have to be taking insulin no matter what, no matter how healthy you try to, get. And so therefore, this piece of the series is of critical importance for those who are trying to implement metabolic therapy. So, we started with, quite a while ago talking about the ketogenic diet. I think there's a lot more to be said about the ketogenic diet that I could, share on. And we have not really talked much about fasting at all. And we've talked about exercise and how it lowers blood glucose and blood glutamine levels even. And we've now talked about red light therapy and how that can lower blood glucose. But I'm going to give some as many things as that could help you with this as possible. And some of those things could be lifestyle practices. So some of those things could be supplementation. Some of those things could be foods and or waters you drink, or light that you're underneath, because this is where people in general need the most help. And so I think that having a comprehensive approach is important. Now, what I will say is that, and you'll start to see it in this video, but even in the next video, when I start talking about kind of natural substances that can lower blood glucose, as in flavonoids and different phytochemicals from foods, you'll start to see some of the familiar names pop up again. And you'll say, oh, that also blocks glutamine uptake and utilization. And you're going to start to see the multiple mechanistic power of some of these nutraceuticals, because unlike, a drug that has one mechanism of action, these substances have multiple mechanisms of action, which can help us on our journey towards health. And so without further ado, let's get into this portion of the section of the talk, which is going to be about vitamin D, vitamin K2, melatonin, chromium, to some degree a little bit about biotin, and alpha lipoic acid, and all of the data that they have behind them to help show how they can help you lower your blood glucose and ultimately your glucose ketone index, and ultimately have success with your metabolic therapy. Hey, Noel. So I'm going to start out with vitamin D. And although some of these papers are talking about supplementation with some of these substances, if you follow the channel at any portion of the time, you know that I'm not a huge fan of supplements when you can get away with it, right? So, and this paper is talking about how 7-dihydrocholesterol is being converted via UBV to vitamin D. It's going to get 25 hydroxylated in the liver to make 25 hydroxy vitamin D, and then the kidneys is going to get 1 hydroxylated to make the active or active form of vitamin D, 125 hydroxy vitamin D. We know from prior study there are many forms of active vitamin D. Colloquially, this is called activated vitamin D. But my point is that many of the other vitamin D hydroxylumosterols and L3, D3 derivatives have plenty of biologic activity. This is the classic kind of end product of the vitamin D pathways that has the most study behind it. So it's this paper is titled Vitamin D and Diabetes, Uncovering the Sunshine Hormone's Role in Glucose Metabolism and Beyond. And it says over the last decade, epidemiology and functional studies have started to reveal a pivotal role of vitamin D in both type 1 and type 2 diabetes pathogenesis. Acting through the vitamin D receptor, VDR, vitamin D regulates insulin secretion in pancreatic beta islets and insulin sensitivity in multiple peripheral metabolic organs. In vitro studies show that type 1 diabetes and type 2 diabetes animal models showed that vitamin D can improve glucose homeostasis by enhancing insulin secretion, reducing inflammation, reducing autoimmunity, preserving beta cell mass. That's big for people who've been on insulin for a long time, and sensitizing insulin's actions. So let's take a walk through this graphic real fast here. So obviously we've kind of walked through the top part of how we make vitamin D. And then once vitamin D enters into a particular cell, it's going to, at least part of its actions, it's going to go through the VDR, right? Vitamin D receptor. Now, there are plenty of other things that it does that is apart from the VDR, but this particular action requires the VDR. And so then it's going to have its, gene expression that happens when the VDR is activated. And then let's take a look at the pancreas. So the pancreas is where we make insulin. And so we can see here that it increases intracellular calcium levels. It increases insulin secretion. It decreases inflammation and interplasmic reticulum stress, which ultimately leads to increased pancreatic function. So this is a big part of what happens when you have diabetes for a long time is the pancreas will get damaged and no longer be able to keep up with the amount of insulin needed, nor sometimes these pancreatic cells actually die and there is no insulin that's able to be secreted. And that's more what happens in type 1 diabetes when you have the autoimmune attack of the pancreatic beta cells. In the muscles, it increases glucose transporters and glucose consumption. And then in fatty acids, it actually will decrease insulin resistance. So it's talking about through various cytokines and chemical pathways where the liver and the actual fat tissue is more sensitive to insulin and ultimately lowers the risk of type 2 diabetes. And then in this paper titled Levels of 25 hydroxy vitamin D3 biochemical parameters and symptoms of depression, anxiety in healthy individuals, it says here that those with lower vitamin D levels had higher levels of triglycerides to HDL ratio, high glucose, and homeostatic model assessment of insulin resistance, or the HOMA-IR index. And it gives some, mechanistic things here. It helps with removing the blockade of lipolysis. So it helps with, being able to burn fat better. It helps with the blockade of gluconeogenesis as well as muscle uptake. And it also, again, in a multimodality fashion, it will shut down insulin resistance. So again, this is why I did the preface, because these are using supplementation, but I always recommend getting it from the sun, or from even probably a secondary better source would be from like a Spurdy vitamin D lamp or something like that. But anyway, so this shows that there was results showed a significant decline in the vitamin D group, as shown with fasting blood glucose differences, as well as A1C. So if you had been supplemented with vitamin D, it showed. I think this is probably the most important one to kind of pick out from these papers, is the hemoglobin A1C, because as much as the fasting blood glucose is important, A1C is a much better marker of your overall glucose status. So it decreased the hemoglobin A1C by 0.3%, which is pretty substantial, really. We'll see that some things have a stronger effect. And this is a systematic review of meta-analysis of so this is kind of like a gestalt of a bunch of different studies. As a matter of fact, does it say how many studies are in here? No, but it was 39 trials and nearly 3,000 patients. So this is like about the best you can do with some of these vitamin studies, is get these like large meta-analysis of randomized controlled trials. And basically you're looking at a 0.3% decrease of your A1C. Now, for some people, if your hemoglobin A1C is, very high, that's not going to be enough, right? That's not going to move the needle where you're at. But if you were maybe you're at 5.7, 5.8%, kind of the pre-diabetes range, and now all of a sudden you're in the normal range. Although I do believe that for most people, lower is better within reason. The next compound I wanted to talk about was melatonin. And melatonin also has an interesting relationship between blood glucose and pancreatic function and insulin resistance. So in this paper, it's titled "Melatonin and the Pancreatic Islets: Interrelationships Between Melatonin, Insulin, and Glucagon." And it says the factor has been underestimated. The disruption of diurnal signaling within the islet can be, or may be, one of the most important mechanisms leading to metabolic disturbances. The study of melatonin-insulin interactions in diabetic rat model has revealed the inverse relationship. An increase in melatonin levels leads to a downregulation of insulin secretion and vice versa. So, one of the things we want to do within metabolic therapy is lower glucose and lower insulin. And as a matter of fact, if we go really far back to the ketogenic diet papers, when Dr. Seyfried and his group are talking about what they believe to be some of the most important benefits to the ketogenic diet, they actually put lowering insulin levels as being even more important than lowering blood glucose, because insulin is such a strong growth hormone and it's such a strong kind of anabolic hormone. So I do believe that whenever we can see that the insulin levels are lowered, as long as it's in combination with lower blood glucose, which we will see with melatonin use, I think that's going to be a very good thing for us. And this graphic kind of represents how melatonin and insulin kind of have a antagonistic role. So this paper was pulled from Nature Reviews in Endocrinology, and it says melatonin and type 2 diabetes mellitus and obesity. It says in the past 9 years, this paper was published in 2019. In the past 9 years, genome-wide association studies, GWAS, have established a major role for genetic variation within the melatonin 1B receptor in regulating fasting plasma glucose levels and in affecting the risk of type 2 diabetes mellitus. The discovery generated a major interest within the melatonergic system, in particular the melatonergic 2 receptor, which is encoded by that particular gene. And although that paper, is not really like very exciting in terms of its abstract, what I will say is the graphic was fantastic. So what it's showing here is that melatonin is responsible for regulation of the suprachiasmatic nucleus, the SCN here, and the regulation of the master clock in the brain. And that master clock is going to set the peripheral clocks in the organs and all over the body. And so we know that melatonin is a diurnal hormone. It's made and released. Well, I should say it's made during the day, but it's released at night. And then it is going to be having its actions mostly at night. Now, that's the classical way of thinking about it. We now know from the work of Russell Reeder and Scott Zimmerman that when we're exposed to red and infrared light, we also can make melatonin during the day within the cells, which I believe has a different kind of overall mechanism because it's not really released into the serum. It's used inside its own respective cell and kind of in a paracontraction where it's used in the local environment. But I'll digress. So this is more the classical way of looking at it. And we see here that melatonin, when it's affecting the skeletal muscle, it will improve functioning of the insulin receptor, and it will increase glucose uptake via the increase in the transporters, the GLUT4 transporters in the muscle cells. So that's one way to lower blood glucose. It's also going to increase glycogen synthesis, so the storage of glucose, and it's going to decrease the glucose production in the liver. And then in the fat cells, it's actually going to decrease lipolysis and fatty acid transport within fat cells. And then within the pancreas itself, it actually will increase beta cell survival. It will increase the ability to make insulin when needed. And it overall just improves the pancreatic function. So these are all like really important things when it comes to like talking about prediabetes, diabetes, obesity, metabolic syndrome, etc. But stay with me because this is critically important for us within the cancers and metabolic disease group, because this will affect our blood glucose level and our GKI. So again, this is like another paper called Chronomedicine and type 2 diabetes mellitus, shining some light on melatonin. And I wanted to, in particular, show this graphic. So we see here that melatonin, when it's normal, quote unquote, we're going to have good effects at the level of the fat, at the pancreas, and at the liver. But when melatonin is reduced to some degree, we're going to see plasma glucose rise, plasma triglycerides rise, and LDL cholesterol rise via increases in leptin at the level of the fat, decreases in insulin production able to be produced by the pancreas, and increases in glucagon, basically making more glucose by the liver and releasing to the circulation, and then decreases in glucose uptake by the liver. So that will affect the amount of glucagon made by the liver. So my point is that, and I misspoke, the glucagon is actually made in the pancreas and the alpha cells. But my point is that it'll affect the amount of glucose released by the liver, when under the influence of glucagon. So my point is that melatonin, we've talked about its effect on multiple areas of biology, whether it be as a powerful antioxidant, as an anti-cancer, blocking glucose uptake, blocking glucose utilization, restoring the Warburg effect, blocking so many different pathways associated with the cancer process and some of the major vicious cycles that cancer has. But you can see here that melatonin is one of our main guardians, along with vitamin D, right? Vitamin D is one of our major endogenous kind of guardians. And this is why I start with these particular molecules in general, because these things are free, right? Like if you go outside and get sun, you're going to get the effects of these things and you're going to get it for free, right? And it's better to get it outside than it is from a pill. Always, always, always. Same with melatonin. Melatonin is also free. So when you mind your light environment at night and you're not exposed to light at night, or at least blue light, but it can really be anywhere from green all the way down to violet, which is where the melanopsin receptor in the back of your eye is affected by. When you have darkness at the proper times of the day and night, and when you have exposure to the sun or at least red and infrared light throughout the day, you're going to make your own melatonin. These are essentially free things, and this is what protects us from diseases that we don't want to have, right? So we're talking mostly about cancer, but this is how the system is broken down over time. first you kind of end up with like some, increase, blood sugar levels. You're kind of this pre-diabetes range. You're not able to lose weight because your insulin levels are high. And then all of a sudden now, 10 years later, you have horrible diabetes and you have cancer. This is how it happens. We got to protect these endogenous systems. And so, although, in this slide here, we're going to talk about how the supplementation of melatonin can radically improve our diabetes situation, as shown in these systemic review and meta-analysis. It's much better, unless you have cancer, really, it's better to not rely on supplementation. You need to get dark at night and you need to get infrared and red light during the day, ideally from the sun, because then you're going to get the double whammy of the vitamin D. But my point is that melatonin has a powerful effect on the glycemic control of humans with diabetes. And so our findings in this paper is titled Impact of Melatonin Supplementation on Glycemic Parameters in Patients with Type 2 Diabetes, a Systemic Review and Meta-Analysis. So this was, this meta-analysis looked at, the systemic review looked at upwards of 1,300 papers on melatonin, and it found 8 randomized controlled trials that were included in this meta-analysis. And so it said here that our findings indicated that melatonin supplementation significantly decreased fasting blood glucose by 12 points and insulin. Okay, so it decreased glucose and insulin, because when glucose goes down, the need for insulin goes down, right? So then we won't need insulin, that growth hormone that can potentially make cancer worse. And then hemoglobin A1C dropped by 0.79%. So if anybody knows what, in the diabetes world, points of A1C and improvements, 0.79 is a very significant number. So melatonin is powerful, and we've already looked at vitamin D lowering another 0.3%. So, you can't make the assumption that it's 0.3 plus 0.79, but there's going to be it's going to be improved, and it's going to be somewhere in the middle of there. So you're probably looking at somewhere a point of lowering your A1C. Now, for some people, if you're at 10%, like I said, that's you're going the right direction, but you still got a long ways to go and a lot of other things to do. And we have other tools in our tool bag that we're going to see throughout this series to do that. But that being said, if you are, I don't know, you're trying the ketogenic diet, you're trying fasting, you're not able to get where you want to get, vitamin D and melatonin can help you get over the finish line potentially. So someone asked a great question. And the question is, why is it different if you have cancer, please? So the reason I say people who don't have cancer should not supplement with melatonin is because you have all the melatonin you'll ever need for free, okay? And that is by fixing your circadian rhythms, getting dark at the right time, and getting light at the right time. And in particular, what I mean by light is I mean infrared and red light for melatonin. For vitamin D, obviously we need UVB, okay? So the best possible light source for all humans is the sun, period. Now, what I'll say is that if you have cancer, I want you doing those things too. Actually, first and foremost, you need to do those things because there's other beneficial effects to these chemicals floating around in your body continuously, as well as exposure to sunlight with the effects on POMC and other chemicals. But my point is that I do think that a risk versus benefit conversation could be had between you and your integrative doctor about if supplementation of melatonin for a short time while you're doing your metabolic therapies could be beneficial. I think in general, it's probably a win for most people. That doesn't mean I'm telling you to do it. It just means that I'm more okay with supplementation with people with cancer only if they're doing the other stuff first too, right? If you don't have cancer doing preventive medicine, then that's where you like perfect your circadian rhythms, get your sunlight, etc. I hope that clarifies things. Thank you so much for the super chat. Okay, so let's move on here to vitamin K2. So vitamin K2 had much more of an effect on the glycemic system than I was aware of until I started doing this research, okay? So this underscores the importance of, so if you're doing sunlight, you should be probably looking for obviously first and foremost a food source of vitamin K2. But if you're doing supplementation with vitamin D, pills, supplements, then you would also want to do it with K2 as well. Okay. Not only for the calcium effects, but also for the additional effects that we're getting from the vitamin. So in this paper is titled The Effects of Vitamin K2 on Type 2 Diabetes Mellitus, a review. It says in recent years, evidence from perspective of observational studies and clinical trials has shown that type 2 diabetes mellitus risk reduction with vitamin K2 supplementation. We did an overview of currently available studies to assess the effects of vitamin K2 supplementation on insulin sensitivity, glycemic control, and reviewed the underlying mechanisms. And this paper was published in 2018. We proposed that vitamin K2 improved insulin sensitivity through improvement in vitamin K-dependent protein osteocalcin, anti-inflammatory properties, and lipid-lowering effects. So I took all the graphics from this paper, and this one's in particularly talking about how when you have chronic low-level inflammation, one of the quote-unquote 4 horsemen that one of my mentors taught me, chronic low-level inflammation cause all kinds of problems, okay? But what also does is that it reduces glucose uptake and glycogen synthesis and all these other things, right? And these things, and because K2 inhibits inflammation, then they believe there's improvements in the glycemic control. That's probably the I don't want to say flimsy, but that's probably the most kind of tertiary mechanisms. I think these are probably the most important mechanisms, with osteocalcin and having vitamin 2 be a cofactor for that, or the carboxylation of that, and then that increasing adiponectin and affecting how adiponectin is signaled in the liver and in the muscles, and then downstream affecting AMPK and PPAR alpha and so on and so forth, which then ultimately leads to decreased glucose output from the liver. Okay. And then in the muscles, the same, kind of chemical milieu is going to increase glucose uptake in the muscles and increase fatty acid oxidation, and basically lead to more energy utilization by the muscles, which ultimately steals blood glucose out of the plasma and decreases the amount put into the plasma, right? Which ultimately will increase insulin sensitivity. And ultimately, this is how exercise, at least, how do I say this? At least from a very mechanistic view of how, we believe exercise helps for cancer, is basically stealing the blood glucose out of the systemic, plasma circulation and creating another demand on glucose. That way that cancer has to compete against some other factors, right? And so if you look at a lot of these mechanisms of how these vitamins, minerals, et cetera, work, it's going to be at least partially by decreasing glucose output from the liver and increasing uptake by the muscles. Now, what I would say is these things are being studied in a vacuum, like most things within medicine, which I think is important to see mechanisms and even unilateral benefits. But I don't understand why people stop there. Why would you not look at something like this, or a vitamin D or a melatonin, and then add exercise, or add, whatever, vitamin D and K2, I haven't seen any studies for that, So I would love to see some more combination studies, kind of how I have the same complaints about, there's really no comprehensive studies on, DAWN or ketogenic diets with these combination approaches, where that's where, in my belief, science should be going. But I'll digress. And then the other mechanism they propose in this paper is that, basically vitamin K2 will ultimately improve your ability to lose weight, and your triglycerides will drop. And then when triglycerides drop, that has effects on hexokinase and other kind of enzymes that will ultimately lead to insulin sensitivity and lower blood glucose. I think this is probably the most important mechanism, if you want me to be honest with you, from the paper. I'm not saying these other are not valid or not important. It's just this seems to be the most kind of the strongest mechanism, let's put it that way. And so what do we see when vitamin K2 is actually given to people. And so this paper is titled, well, I'm going to start with that. I'm actually going to start with this one because this one's actually published sooner, right? This one's published in 2020. This one's published in 2023. So let's start with this one. This one's titled Effects of MK7 Supplementation on Glycemic Status, Anthropometric Indices, and Lipid Profile in Patients with Type 2 Diabetes, a randomized controlled trial. And it says here, basically in the results that, and just to be clear, these people were getting 200 micrograms of vitamin D or vitamin K2 MK7, excuse me, and they were giving it to them for 12 weeks. Okay, so vitamin K2 intake increased significantly at the end of the study versus the placebo groups, but so fasting. So let's see here, but intergroup differences were not significant. Fasting blood sugar, A1C, fasting insulin, and HOMA-IR decreased significantly in the MK7 group. Furthermore, after adjustments for the baseline values and changes in vitamin K intake at the end of the study, fasting blood sugar and A1C showed significant intergroup changes, and they were significantly lower in the MK7 group compared to the placebo group. So I have not seen a lot of data for MK4. So I just want to throw that out there. Most of the studies I've seen were with MK7, and there wasn't a lot of studies, to be very fair. I just don't think that there's a lot of appetite for these type of studies within the conventional research community, because there's probably going to be very little money available for, blockbuster drugs that are developed. But there is data, right? And so this one is titled The Effects of Vitamin K4 and Supplementation on Insulin Resistance in Individuals with Type 2 Diabetes mellitus. And I just want to be clear. I looked up vitamin K4, and I kind of already forgot, but it was like a very special kind of like form of vitamin K that I had not heard of before, and nor have I seen supplementation for, or really any results, any literature for. So I'll digress. But they were supplemented with vitamin K4, not K2 MK4, K4. After 24 weeks of this, the HOMA-IR showed significant differences. Fasting serum insulin decreased significantly, nearly 50% decreases in fasting serum insulin when compared to the placebo groups. So vitamin K overall, K1, K2, and this K4, which I need to do some more research on to see if that's even naturally occurring or not. But that being said, we need to see whether or not we have access to these things, because it seems like, at least from the fasting insulin side, but look at the HOMA-IR. HOMA-IR decreased by more than 50%. So, or it improved by more than 50%. So I think that there's a lot of promise. And this was done for 24 weeks. So it was done for twice as long as this study. So it seems to continue to show benefit past the 12-week mark with some of these supplements. So this is another one on vitamin K2 published in 2021. It says glycemic control improvements in individuals with type 2 diabetes mellitus with vitamin K2 supplementation, a randomized controlled trial. And these folks got either 180 micrograms twice per day. So they got more than this paper. This paper got 200 mics per day. These people are getting 360 for 12 weeks also. And it says at the end of the trial, fasting blood glucose effect size was down by, seemingly about 32%. And then the A1C dropped by, looks like 0.36%. Were significantly lower in the K2 group compared to the placebo group. So vitamin K2 seems to be a pretty powerhouse, intervention, potential intervention for folks with hyperglycemia, diabetes, and just to help those who are maybe already near the mark with their glucose and getting their GKI where they want it to be, to maybe get them across the finish line. Now, I need to do a deep dive on vitamin K2 to see if there's any effects on glucose inhibition at the level of the cell, right? Like whether it be like literal glycolysis inhibition or reversal of the Warburg effect or glutamine. I don't remember in my glutamine series when I was doing a lot of deep dives on a lot of different supplements, whether or not I saw any data for that. I do believe there could be some data for cancer as a whole, but I'm trying to focus on things that affect the kind of the metabolic approach. And it seems like K2 seems to be, get the green light in terms of being able to lower blood glucose, which could obviously have a massive effect on your GKI and ultimately your success with metabolic therapy. So you can see here that probably a vitamin D K2 supplement, if you weren't able to get sunlight or even artificial UV, could be a good combination, or just K2 by itself if you're able to get it from light, which would be ideal. You are going to need, substantial doses of K2, MK7. So again, the other study was using 200 micrograms per day. This is using 360 micrograms per day to get these effects shown in these studies. So the next thing I want to talk about is some other vitamins and minerals and kind of like things that are natural that can have effects on the insulin sensitivity, blood glucose, et cetera. And I sold this graphic from my functional medicine course that I took through the IFM. And basically, it's showing here that there are several kind of like needed kind of cofactors and coenzymes for the insulin receptor to work well as the glucose transporters to actually be upregulated and brought to their proper place. And so some of those things are like vanadium, chromium, cinnamon. Obviously not a required, but it can help with the insulin sensitivity, as well as alpha lipoic acid, chromium, biotin, and alpha lipoic acid. And so I found this pretty cool paper published in 2023. It's called The Comparative Effects of Vitamin and Mineral Supplementation in the Management of Type 2 Diabetes in Primary Care, a systemic review and network meta-analysis of randomized controlled trials. And I'm not going to read the abstract for this particular, because it's pretty long and it's not really giving us what I'm really wanting to show you as much as the graphic that it has. And it shows here that, before I show this, let me show this. So they looked at like every trace mineral and vitamin, and they looked at all the studies on blood glucose. On this particular one, they're looking at A1C, right? And then they're looking at fasting insulin levels for those same vitamins and minerals. And so they were able to classify it as high quality evidence, moderate evidence, low evidence, or very low evidence. My gestalt is that, let's say hypothetically, magnesium has mostly very low or low evidence of improvements of your A1C, but there's like, I don't know, 100 studies that are not very good. Like, you would think you could aggregate those and say, well, in average, even though these are poorly quality studies, in general, we're getting, XYZ, A1C decreases. So although I'm not going to cover magnesium or selenium or vanadium or B12 or whatnot, it doesn't mean there's not effects by these vitamins and minerals. It's just that I picked the kind of most high yield ones based off of the literature that I could find. So what I'm saying is that they looked at all these, right, for both A1C and for fasting insulin, and then they came up with this kind of graphic here. And they showed that, in terms of fasting blood glucose, and HOMA-IR, chromium was kind of the superstar for that. And then for insulin and A1C, vitamin K was the most effective. And then for these other lipid parameters, which is not as important for our talk here when it comes to cancerous metabolic disease and lowering your blood glucose, lowering your GKI, there's these, vitamins and minerals, et cetera, right? So I'm going to start out by talking with chromium. And this paper was published in 2023, and it's called A Comparative Study to Assess the Use of Chromium in Type 2 Diabetes Mellitus. And it says here that the A1C at the start of the individual, the initial A1C level at the start of the study for individuals receiving chromium was 10.4%, which is not good. Okay, it's actually quite bad. I mean, it's not horrible, but it's not good. 10%. And then following up the period, the A1C significantly decreased to 7.2%. Now, we have talked about how in this particular review, how vitamin K2 lowered it by 0.36%, how melatonin lowered it by 0.79%, and vitamin D lowered it by 0.3%, all of which are significant decreases in the amount of, basically sugar in your blood on average with looking at these A1Cs. But this is unbelievable. This is a more than 3% drop in the A1Cs. Now, these people have a long way to go, right? They have quite bad diabetes. Okay, 10% is bad, but 7.2% is not where we want to be, right? But that is much, much better. I mean, there are calculators that'll actually calculate if you have this A1C, your average blood glucose is X. And so I would have to guess that your average blood glucose dropped significantly, lowering the A1C from 10.4 to 7.2%. So I just want to say that chromium, out of all the ones we've seen so far, has been by far and away the most powerful. And there's, several proposed mechanisms of how chromium works. Chromium actually affects how the insulin receptor works and improves the insulin receptor, function. It will affect the endoplasmic reticulum stressors. It will affect, translocation of the glucose transporters to the actual cell, membrane. It will affect how the cell membrane works. Or not the cell membrane, but the glucose transporter works. And, you'll see here that chromium also affects upregulation of the glucose transporters. So it has multiple mechanisms of action. And this is why its central role in this graphic here, on both glucose transporters as well as the insulin, it's very important, chromium. So let's take a look further down here at this paper here is published in 2020. It says the effects of chromium supplementation on glucose or glycemic control in patients with type 2 diabetes mellitus, a systemic review and meta-analysis of randomized controlled trials. And it says here that chromium supplementation, given these patients, we see fasting blood glucose levels that are lower, insulin levels that are lower, A1C levels that are lower, as well as HOMA-IR levels that are lower with these people with chromium supplementation. And here it says that the fasting blood glucose dropped by, and let's just take a look. It doesn't say, because this is a meta-analysis, it's not showing exactly what the studies were using, but there's 28 studies reporting decreases in these key parameters with diabetes and blood sugar. So it decreased the fasting blood glucose on average by 19 milligrams per deciliter. Substantial levels here. It decreased insulin levels substantially. It decreased A1C here in this paper, in this meta-analysis, by on average, basically 0.7%, which is more kind of in line with some of the other things we've been looking at. This particular study was looking at just kind of a gestalt also of the published literature. And this may have been, a smaller database. This was also published, in 2023 versus 2020. So it's kind of hard to know where the differences lie without really digging into the meat of the paper and like the papers they selected. Maybe they were more choosy with the papers, et cetera, et cetera. My point is that we're seeing over and over again that chromium seems to be a rock star when it comes to lowering blood glucose for diabetics, especially for diabetics. And then this paper is published as early as 2007. So we've known this for a long time. These minerals and these vitamins have effects on diabetes. It showed here that a combination of chromium and biotin. Biotin is one of the other, vitamins here that are shown in this particular graphic. And it says here that the primary analyses of combined this combined therapy lowered A1C, glucose, and compared to the placebo group. So it didn't give me the exact values in this particular abstract, but and I can't remember if this paper was available for free or not, but you may be able to find, if there was any decreases or improvements. Let's just say hypothetically use the low ball, number here, 0.7%. Was there an improvement by adding biotin? In this particular study, they use 600 micrograms of chromium, which is about 3 times what I've seen in most supplements that are like just trace mineral supplements, as chromium piconolate, and then they use 2 milligrams of biotin. So just to look at the dosages used for this particular study back from 2007. I'm going to finish out today talking about lipoic acid. Now, lipoic acid is something your body actually makes on its own. You don't have to supplement with it. But when you do supplement with it, there's a lot of benefits that can be given. And in this case, we're looking at the mechanism. So this was published in Nutrients in 2022, and it's called Alpha-Lipoic Acid and Glucose Metabolism, a comprehensive update on biochemical and therapeutic features. And it says here that alpha-lipoic acid is a natural compound with antioxidant and pro-oxidant properties, which has effects on the regulation of insulin sensitivity, and insulin secretion. I want to touch on this. So this is an important point. So in some in in some cases, you'll see alpha lipoic acid being a very powerful antioxidant, but it also says it has pro-oxidant properties. What does that mean? Well, what I've seen, at least in the research that I've looked at for cancer, and I'll cover alpha lipoic acid when it comes to its effects for metabolic therapy. There's actually papers on it when it's combined with citrate, hydroxycitrate. But that being said, is what you'll see is that in cancer cells in particular, it has a pro-oxidant effect and actually increases ROS, which then can help damage cancer cells and kill them. So it's interesting that these, one supplement or one natural product can have, opposite effects depending on the environment that it's put in, whether it be a healthy cell that needs some help or it's a damaged, cancer cell that needs to be killed. Interesting. I wanted to digress off of that. ALA is widely prescribed in patients with diabetic polyneuropathies due to its positive effects on nerve conduction and alleviation of symptoms. It is, moreover, also prescribed in other insulin resistance conditions such as metabolic syndrome, polycystic ovarian syndrome, and obesity. And what we're seeing here is that when ALA is added, it's actually affecting at multiple levels how the insulin receptor actually works. And then on top of that, ALA will stimulate AMPK, which will lead to mitochondrial biogenesis or more healthy mitochondria, and upregulations of the GLUT transporters to help remove glucose from the actual bloodstream. This is mostly seen in the studies that I've seen in muscle cells. It's most common, the mechanism. And then in addition to that, unlike a lot of other substances, ALA is actually part of the PDH or the PDC, the pyruvate dehydrogenase complex, also known as pyruvate dehydrogenase, the enzyme that actually converts pyruvate into acetyl-CoA. Now, we've talked about that at length in our metabolic, through this series, I guess. And because PDC and PDH, aka, is blocked by hypoxia factors. And so when you have, when we give melatonin, we give DCA, when we give, thiamine, it can unlock PDH and allow pyruvate that is being shuttled into lactate and let it get into the mitochondria to be converted into acetyl-CoA. So alpha lipoic acid is actually a major cofactor or coenzyme, for PDH. So if you're deficient in ALA, that can increase your risk of having a Warburg type metabolism. And what I can also say is that it can increase or reverse Warburg metabolism via this mechanism as well. So ALA has far-reaching effects, but we're looking at it in this particular case on blood glucose, insulin, et cetera, et cetera. So this is a paper that was published just about a year ago, January 2024, and it's called The Effects of Alpha Lipoic Acid Supplementation on Anthropometric, Glycemic, Lipid, Oxidative Stress, and Hormonal Parameters in Individuals with Polycystic Ovarian Syndrome, a systemic review and meta-analysis of randomized controlled trials. And it says here that the ALA group had significant reductions in fasting blood glucose levels. It had effects on the HOMA-IR as well as I want to say insulin reductions as well. So you'd have to actually dig through the paper. You can see here that there's mean treatment amounts of things, and I pulled this graph out, looking at various things that it does. For example, the B portion of this is looking at insulin, or excuse me, A is looking at fasting blood sugar. You see decreases in fasting blood sugar on average, in fasting insulin on average, and HOMA-IR on average using alpha lipoic acid. And as a matter of fact, I pulled this again from the Institute for Functional Medicine's kind of like cardiometabolic lectures that they were giving. And so, ALA is here at the level of the insulin receptor as well as here. And, it's a pretty powerful intervention for diabetics, not only for diabetics for their blood sugar, but also for neuropathy. It seems to be a very powerful intervention for that. So I know that most of these studies are talking about metabolic syndrome, obesity, PCOS, diabetes, et cetera, insulin resistance. don't get lost in that, because first of all, obviously people who have cancer can have those problems as well, right? But what I want to in particular look at is the effects and the power of these particular modalities in lowering our blood glucose, improving our insulin sensitivity, and overall lowering insulin levels, so that we can have a more effective chance at implementing metabolic therapy and getting to those glucose targets and those GKI targets. So I hope this was helpful. I have a ton more to share. When we're looking at cancer's metabolic disease and lowering blood glucose, obviously I want to give you guys as many tools in your tool bag as humanly possible, and to give you success with this therapy. And like I said, as I said at the beginning, blood glucose is the bane of all of our existence within this type of treatment modality. Getting your blood glucose down, even people who are seemingly metabolically healthy, to get the levels down to where they need to be is very difficult. And these are just some tools in our tool bag that we can add in. You can see that they're not in a vacuum. We've talked about melatonin, talked about vitamin D in particular with cancer. Its effects on a whole host of mechanisms that are seen affected by cancer. We have not talked about vitamin K2. We've not talked about ALA yet, but we will in the future. We will talk about vitamin K2 and ALA with cancer as a whole, to show its other additional benefits. But needless to say, this is a critical step, because if our blood glucose is out of control, we're never going to get to that GKI we want, and we're not going to have the success that we're looking for with metabolic therapies and metabolic approaches. Excuse me. So one of our listeners says that I'm doing melatonin and vitamin D lamp or sun with 800 micrograms of vitamin K2 MK7 daily. That's a lot of K2, but that's probably a good amount if you're getting a ton of vitamin D. And then exercise is painful. Yes, it is. Can be very painful, and it can be very annoying sometimes, but it's so powerful, and it's just, and it's free. It just takes discipline and mental fortitude on those days where it's really difficult, to get out there and do it. I will say that, if you can exercise outside, that is by far and away better, because now you're exercising under red and infrared light. You're getting the effects of vitamin D from the, UV. I mean, it's just like multiple benefits. If you exercise grounded, we haven't talked about grounding at all, but grounding, there's not a lot of data on grounding, but grounding, earthing, et cetera, can lower inflammation. Inflammation, we've seen in some of these publications, can lower blood sugar. So, there's probably like multiple effects of exercising outside grounded. Imagine like swimming in the ocean outside in the sun, like that would be like best case scenario, probably. Let's see here. Have thoughts on vitamin D via IV? I'm not so sure. Perhaps talk. I have not seen vitamin D given IV, but I had one patient once in my functional medicine clinic who was using IV, or I can't remember if it was IM, like maybe intramuscular injections of vitamin D. I have not seen it regularly. What I would say is it's the same for me as by mouth, right? There is no way to encapsulate vitamin D and the vitamin D system, okay? Because there are so many other vitamin D, L3, D3 analogs that are made when you're exposed to sunlight. Plus, the sunlight is giving you all the other chemicals that we haven't even had a chance to talk about. We talked about melatonin. We haven't talked about like the POMC. We haven't talked about anything else. So I would believe that I would not want to use by mouth or IV vitamin D supplementation unless it was the absolute last resort. What foods are rich in chromium? I'd have to actually look that up. I would say definitely like seafoods are generally high in trace minerals. I suspect vegetables, but I would have to look that up, actually, the chromium part of it. Taking RALA. Wow. If you're taking, RALA is generally much more expensive. It is a better quality product. Let's see here. I have MM. I'm guessing multiple myeloma, and am not doing chemo radiation. I'm following the sugar trial. Okay. I'm sorry you have multiple myeloma. Sorry, off topic. Is the online course from you, Implement Metabolic Therapy, legit? Thanks. Is it legit? Wow. I would hope that I would say it's legit because I'm teaching it tonight at 7 p.m. Yeah, I think it's legit. I think that it is a very comprehensive course. I um, I really enjoy teaching the course. In November, I think I had 10 people or 12 people, and in December, I had like 23 people. I was a little intimidated by having more people in the course, but it actually ended up being really cool and creating like a neat organic dynamic where people were like, "Oh, I'm from Australia. I'm from Australia." And it was just really neat to see like connections being made, like unintentionally. And it's just I go over metabolic therapy the way that I see it, which is pretty comprehensive. And I try to give you as many tools in your tool bag as possible to have success and have other therapies that are not talked about by Seyfried dovetail into metabolic therapy. And yeah, I think it's legit. I think people like it. I'm trying to improve it all the time because I'm never going to be settling for what I have now. What is the best vitamin D blood level to have anti-cancer effects? Yeah, so this is a discussion between your doctor, as always. I can't give medical advice, but what I would say is I would get it as high as I possibly could get it without causing significant side effects. The most common or most kind of feared complication of high vitamin D levels is hypercalcemia or high blood calcium levels. I'm telling you, I think it's a theoretical. It is a theoretical side effect. I routinely, I'm probably 90% or more of people that I check a vitamin D level on in the hospital or in the clinic, they have, they have low vitamin D levels. So it's not much of an issue. But for the select few of people that I've actually seen have high vitamin D levels, like above 100 nanograms per milliliter, or even like above 120, which is usually the cutoff at most labs, I have not seen hypercalcemia be common. And if I've seen it a couple times, but I would say it's probably like 20% or less of the time I've seen it. And I also say that I don't know if those people that have those vitamin D levels that are above 120, if they're taking vitamin K2 and how much they're taking. So I would be very curious to even substratify those people to see whether or not they truly have hypercalcemia. It's only secondary to high blood vitamin D levels. Awesome. See you tonight. Okay, good. I'm happy to see you tonight too. Purinic acid. No, I believe that you brought that up in the comments. That was something that you brought up in the comments about pomegranates, correct? And I have not heard of it nor looked into it. Obviously, the ellagic acid is very well known, and I'll talk about it quite a bit during I think it's a glycolysis inhibitor, if I'm not mistaken. But no, I have not. I have to look into that and send me what you found about it, because I don't know if it has effects on glucose, glutamine, or whatnot, and we can look into it. Well, I guess we've gone about 57 minutes and 45 seconds. So unless there's any further questions about the topics of today, we will continue on our study in how to lower blood glucose using natural substances and natural modalities in the next video, talking about a lot of herbal things and kind of nutraceutical things that which will dovetail beautifully into metabolic therapy, because there's things we've already talked about so far when talking about lowering glutamine uptake and utilization. So as you can see, these things are not in a vacuum, and they have multiple effects that can be beneficial for our purposes, as kind of treating cancer as a mitochondrial metabolic disease. If you like videos like this, please like, share, subscribe, and until next time, God bless.